When I first into practice, it was like almost like if you turn 5 or 6 year old kid, you're gonna have a tonsillectomy surgery. Now we don't do it so often. What is the proper indication if you were ever going to take out tonsils or adenoids?
Years ago, the most common indication for tonsillectomy and adenoidectomy was recurrent throat infection. And it used to be there was really no particular guidelines as to when tonsils should come out, so it would sort of be on the whim of the pediatrician or the otolaryngologist to say, you know, I think he's had enough infections, let's have the tonsils taken out. In 1984, Dr. Jack Paradise in Pittsburgh published a paper in the New England Journal of Medicine showing that more specific guidelines were needed to really obtain a benefit from a tonsillectomy and adenoidectomy. And what he found is that if a child has recurrent throat infections, 7 infections in 1 year, 5 infections a year for 2 years in a row, or 3 throat infections per year for 3 years in a row, that was a child who really benefited from having their tonsils and adenoids removed. Anything less than that, there was not a statistical benefit. Since that time, we now take tonsils out frequently, but the most common indication is not recurrent throat infection, but rather for obstruction. That means big tonsils and adenoids that cause snoring, mouth breathing, difficulty sleeping, difficulty swallowing, and sometimes in an extreme case, sleep apnea. Fortunately now we have a newer operation for that particular problem where we remove the adenoids, and rather than remove the tonsils completely, we shave them down. That's an option we are offering parents, which we've been doing for the last 5 years, and the benefit of doing it that way is that it's a lot less painful, the risk of bleeding is almost negligible, and the child has a much quicker recuperation. The only downside to not removing the tonsil completely is there's always a small chance it can grow back. But so far, with 5 years of experience, we've been finding that it happens very rarely because we end up removing approximately 85 to 90% of the tonsil.